So I got to get a little closer to this.
Okay.
So hopefully somewhere in 2019, we'll be formally launching the initiative.
Okay. So, and then 18 months to complete the report.
Actually, a foundation called the Chow Foundation. They live in Hong Kong, and the family is also Singapore. They have just provided 500,000,
250.
250.
Question, so historically, when the National Academy produces a report like this, and it's got a specific policy recommendation, it hits the agency that's doing it. You know, if I were one of these, professional lifetime bureaucrats and someone issues me this report, I kind of look at it, I would worry about organizational uptake. And so when I was looking at the masthead of everybody who was on there, I was thinking, well, gosh, you throw some kind of relatively senior long-term FDA person who can be an internal champion when this report hits. Yeah.
Our Foreign Secretary, Peggy Hamburg, is the past FDA commissioner.
Oh, and so she, yeah.
And many of these studies, Ned, not in this case, but many others are actually commissioned by Congress.
Right.
So the FDA funds the study. Say, we're getting a lot of questions, we're not sure what direction to go in this, we want an objective report, here's the money, do the report. So they're waiting for the recommendations.
I see.
I chaired one of these studies that had to do with workforce issues in elder care. And we just had the 10th anniversary of it. So we went back and looked at our 18 recommendations, and 10 of them had been implemented.
Yeah, and oversight.
So it's not like you're preaching into the forest, and nobody's listening.
Yeah.
But staffers read every one of our report, memorize it, because they know that it will be brought up many policy issues.
And the uniqueness of the structure and approach that we're using with this is that sort of international oversight body, which is a little atypical from our traditional model at the academies. And so that's sort of a key opportunity to bring in either, the former government folks, existing healthcare leaders, and to
Ned, give you an
get there.
example. I did a initiative called Vital Directions. Liz also led it. This is the one that looks at the entire healthcare landscape. We did it because we knew there's going to be change in U.S. administration, but we didn't anticipate the current administration. But nevertheless, it was effective, useful. I had on the steering committee Bill Frist, Mike Levitt, Tom Dashow, 2 or 3 FDA previous commissioner, including Peggy Hamburg, Jane Henney. They're actually all members of the academy. And so that was easy. So Bill Frist and I just went up to Congress and just make our rounds, right? And Tom Dash on the other side of the aisle, we make our rounds. And so I think that we get the attention of a lot of people looking at them. Now, I can say that immediately they're going to adopt them. It's going to be some hard work, but doors can open fairly easily for us. Okay.
And we need
Thank
to
you.
go back in your slides to this. That's it. After we hear from Victor and we grab our lunch, we're going to talk about where on this slide we put this group, okay? That's convened here today, and where it influences the process and how the input can be useful, right? That's basically what we're.
Yeah, let's talk about that, because we have all this academy rules and regulation we need to follow.
Right. So that's why it's not on the slide,
Yeah.
but, because it's not part of the.
Well, it's
formal
much
slide.
higher, because this is only one project, that you are my advisory council, look at multiple activities.
Yeah, but we'll put this activity in the context of this.
Sure.
Yeah.
Okay, should I talk about price?
Yes.
So you can see
Oh,
that, it's a small room, don't worry about it.
Yeah, Sharon, are you with us still?
I'm definitely with it.
Okay.
Sharon, you're amazing.
Sonia, are you with us still?
I don't think Sonia can hear. She needs to dial back in.
Okay, anybody else on the phone? All right, go ahead, Victor.
Okay, so I think this grand challenge, just to put things back to perspective, is the Academy's sole grand challenge. I didn't want to do multiple ones because I don't think we have a capacity, nor the focus. I think it's important that we focus on one. And I think this is it. So you can almost argue this is going to be my legacy, right? That I'm taking this on with all of you, making it work, and if we succeed, it's going to have enormous impact. Something we haven't quite done before because it's a much bigger magnitude than what you just heard. We're going to do advisory reports, we're going to do this project or that one. We're currently working on opioids, working on different things. This is a big one. It's international, and it's not only US, and therefore has two components. One, which I think Kavita and Jack so eloquently point out, you can't make the changes unless policy comes along with it. And society really buys this. That's why the roadmap is so important. That is really talking about what do we advise the public? What do we advise the government? How do you change policy? And you saw the 3 or 4 work stream that converges. We also recognize, of course, that there's not going to be one size fits all. But so this will be, which is why we call it roadmap. It's actually the roadmap that you can take to Singapore, to Nigeria, to say this, in fact, international commission is what we have worked on through international commission. We can use it. We have a very similar example not too long ago after Ebola outbreak. Jim Kim, one of my proteges, who's now the head of the World Bank, asked me if I would do an international commission looking at what's wrong and what did not respond to the whole outbreak, whether it's WHO, whether it's other organizations. So we had an international commission, which clearly have driven a lot of changes in WHO and World Bank in terms of their reinsurance program. So our reports will have a lot of implications. Okay, so the second piece is trying to say, the way I look at it is if you take a step backwards, National Institute of Aging has 1/4 the budget of cancer, NCI, 1/4 the budget of NHLBI, heart, lung, and blood. And so I think the budget is small, number one. Second, of course, the priority in the country seems to be more disease-oriented. We talked about that, right? Second is that the way the funding comes about is the traditional NIH funding, which is risk-adverse. You got to have all the feasibility, and so no bold ideas coming through. What we want to do is get people have bold ideas and being able to take bets on them. And third is a high focus on disease versus health. So I think we need to get out of that thinking as well. And if we look at even the private sector where billions of dollars are being spent, I mean, look at where we are in Alzheimer's, nowhere. And I think that, Bill, maybe after my conversation, you can tell people what you're trying to do in J&J, which is why we converse so nicely that you're going to support us in this initiative. That is, we're going to have a whole different way of doing things. So for all those reasons, we thought we need to activate the field, get a lot more people excited about the field, and let people come up with great ideas. And some of these ideas will be breakthroughs. And those breakthroughs obviously will make the big leapfrog going forward, right? Yeah.
I also want to add the point that unlike a lot of diseases like cancer biology, neurodegenerative disease, diabetes, each of those diseases has dozens of foundations that support basic research. For aging, there's only one foundation. And there was, a second Ellison Foundation that contributed to aging, but of course that stopped about 5 years ago.
Yeah, he's backed off from it, yeah.
Right. And so that's a huge difference. And that's why cancer research happens to attract most of the talent.
Yeah, you're exactly right. And and most of the NIA budget is targeted for Alzheimer's, congressionally targeted. So there's just not enough things, in a broad sense. So we, through June's discussion in June, and of course Mark Holditch, who's just left, we thought about how about we do a thing called inducement price. That is that you challenge people to meet a goal. If you meet the goal, you get the prize. So it's unlike the usual grant mechanism where you get the money to do it again and then do another 3 years, etc. to get incremental progress, you want to break through. And here's some examples of the breakthrough prices. First of all, everybody's talking about X Prize, so that's why Mark Holte is so important. The Ansari X Prize put forward for commercial space industry. I believe that the price was $20 million, but today we have multi-billion-dollar commercial industry, right? Not everybody wins the prize, but those who enter develop intellectual properties, ideas, which then drive towards the whole industry.
And the prize has an incentive. Mark told us that one guy spent $30 million to win the $20 million prize.
Yeah, but he created a billion-dollar industry. Yeah. 300 years ago, when people were navigating the seas, particularly at night, there was no means to do this. So the Great Britain came up with an idea of a challenge inducement prize for the country, and the clockmaker came up with longitude, and hence the longitude. And then 300 years now, they're celebrating longitude, creating another set of prizes 300 years later. And this was a UK countrywide or United Kingdom-wide competition looking at what fields. It was health, energy, security, you name it. Health won out, and AMR is actually antimicrobial resistance is this one. This is June's prize. June had a prize in healthy longevity, actually homeostasis, right? And so we can kind of, in a way, expanding on the thing that you started doing.
I mean, I'm going to maybe echo Jack's comment. When I approached the founder of X Prize, well, the two founders, was Peter Diamandis and Keith Powers. They got it going more than 10 years ago. And they said, if you do this prize, you will raise at least 100x of money. You bring that into the field. I'm like, there's no way. And he gave that example. I got to tell you now, we're 5 years into this. It's just stunning, just within the ecosystem of the advisors, how much money they raise and contribute into the field. So I'm now a believer in the power of these prizes to generate excitement, even if the people are spending more money to participate than the
Okay, but this is the coup de grace. 21st Century Cures Act, which was passed about a year and a half ago, Congress wanted a lot more innovation. So they've actually ordered NSF, NIH to come up with inducement prices. Now, so as I'm exploring with NIH right now, they are kind of walking on eggshell. They don't know how to do this. Oh, we need to go through this committee. We have to all this review process. And they just announced the Eureka Prize, which is only $10,000 using digital technology to manage people elderly with Alzheimer's. And so as I talk to them, and when we're now working through our relationship with them, they really are still not quite there yet. However, they are actually compelled by Congress to change the way we do things to get more innovation. Right? So that's the idea behind our prize, so the grand challenge. That is, we want to set the goals of breakthrough, where it makes a huge difference in healthy aging, and hence the idea of the grand prize up here. Right? The grand prize, which June and Martin have generously donated, we want to get more. I'm talking to a few major donors right now. In fact, we're making a video for that person, etc. Is to be able to get prices of the range, we're still to be determined, maybe $5 million, 2-3 prices, maybe more, depending on how much we raise, right? But the idea is to say that is the breakthrough. So that's the inducement idea behind this. And but as we were designing this grand prize, and some of you're on the committee, etc., with Tachi Yamada, who used to be the Gates Foundation Global Health guy, as well as Bob Horowitz from MIT, Nobel laureate, they thought in order to activate the field, setting this prize was great, but we need to actually get a lot more critical mass. So the Gates Foundation Grand Challenge Exploration had this idea of lots of small awards and prizes. A 1 or 2 page application of a bold idea without having to prove that you can do it. And get people to review them, not in the field, but even outside the field, to say, is it bold enough? Will it make a difference? We'll take a bet on you. And this way, they were looking at malaria, mosquito net, many other issues. And so Tachi's successor told us that we should have a base called Catalyst Award. And for those who are very promising, you'll get a longer support called Challenge Awards to be competitive for grand prize. But you don't have to go through this pathway. Anybody who's got a great idea, any globally can compete for the grand prize. Okay, so in other words, we're trying to build a science technology ecosystem for health and longevity. But if people already exist, although think about the breakthrough is not that easy, I think we want to do is catalyze this whole field. So I can imagine that we get people who have not worked in the field to say, whoa, this is really exciting, I want to be part of this, right? And in a somewhat different way, when you think about hackathons and things like that, where every great people who can write some software can compete, you get this tremendous buzz of people entering this field. And we decided not to have a specific scientific discipline. Anything will be okay. Biology, engineering technology, social sciences, you name it, or the best is the combination of the above, right? George.
Just a question on this, because these things can be incredibly effective, and one of the things that we've seen doing some things like that is the tradition of doing them on some kind of annual cycle inhibits the spontaneous innovation that can really be combustible. And so one of the things, I don't know how we're thinking about sequencing it, but whether or not we can do it so that when an idea is there, they can present it and we can, whatever the committee is, can respond rather than making it part of this very formal.
Okay,
stuff. I don't know.
so that would be the case up here. Anybody, anytime ready, can come. This needs some cycling, and I'll tell you why, okay? Because we're now launching it as a global initiative. And you almost, for some reason, for the right reason, need to harmonize selection, harmonize announcement, harmonize. But this is bold ideas, so people can come, once a year, twice a year, that's not a problem. And again, I want Bill to speak up, but here, anytime. So we have put this whole thing, and we guesstimate about 5 to 7 years. I don't want to do this forever. I want to get the field going, right? So the whole idea initially would be several hundred of these Catalyst Awards at $50,000 US, okay? Get thousands of applicants. And for those who have been selected, once a year we're going to have a global summit. In fact, Dean Kamen is perfect for us talking to him tonight because here's this thing called Global First. I don't know if you know or not. These are robotic competition for high school. Last year in Washington, over 1,000 kids from different high school came. And I believe that actually the team from Sri Lanka might have won. I can't remember, but it's very exciting, right? Now, we will probably deal with people a little bit more advanced in the science than high school. But nevertheless, I think you can imagine the excitement for this. So once we get this one, we give them dollars, we say to them, we take no intellectual property. It's yours. Because the whole idea is not to get all entangled with the NIH and whatever, but let the individual take whatever they can do to find the funding, whatever they can do to commercialize and activate the field. But we enable them to begin this. Now, of those very promising ones, we're thinking about X number, 10, 20, of $500,000 to $1 million a year, to help them to, boy, you really got something. Our criteria at the end has to be human, not mouse or earthworms or C. elegans, right? Has to be human. So that means there's got to be some incubation worked through this. And then, of course, the price. So that's the idea behind it. So when we first started, you say, how do you do this? I want to show you. Do you have a slide? Next one? Oh. We have a global initiative. Okay, so when I took this idea to my friends around the world, they just all bought it almost like on the spot. So we have AMED, which is the Japan NIH. This is the Agency for Medical Research and Development. So Suematsu, head of AMED, he says he's in. I just met with him breakfast in Tokyo last week, as a matter of fact, and he just sent me a note because the whole Japanese team was there yesterday. He's agreed to fund. We asked each participant to commit to 3 years, X number of prizes. And the concept is This is going to spend in their own country to activate the scientists and researchers in their own country, right? To enable them to change their country's ecosystem. At the same time, they can compete for the global award. So it's a global initiative with multiple regional competitions, right? Funded by each country, so there's no transfer of money to me, thank God, because I can imagine all the stuff, plus, you know, the US, this thing about foreign government and the whole bit, right? So, anyway, so the idea would be, look at who signed up. AMET for 60 awards, and they say, in our country, to do this, I've identified 3 funds, we have to have indirects, because we said no indirect. I said, sure, if you pay indirect on top of it, I don't care, I want the scientists to have the direct, and he'd agree with that. Singapore, Chechuan Tang, who's the Chief Strategy Officer for the Ministry of Health, who's the last president of National University of Singapore, a good friend, and the National Research Foundation, which is overseen by the Prime Minister's office. They've agreed also, and they will actually host one of the workshops for Roadmap as well. Academia Sinica, which is the Academy of Science in Taiwan, they're celebrating 90 years in November. I and my other presidents will all be there, academy presidents, Marsha, myself, and others. And I said to him, what are your main themes? They say, well, we think about celebrating and launching theme. I said, what about aging? He's in. And their team is working alongside with us continually. Hong Kong, I say, to be determined. And Edgar, actually, George and I saw the chief executive. And by the way, the chief executive says, if Edgar's involved, I like it. That's what she said. And with Victor Fong, and we're probably going to work on the public-private partnership. That is, she says she wants to do it. She said, I need to find which agency is going to fund it. So we're still working through this. Let me skip over EU. UK has totally reorganized their research under now one umbrella called UK Research Innovation. And so NRC, different funding agencies come under one huge funding base. The person in charge is Mark Wolpert. Mark was the head of Wellcome Trust, then he became the Chief Science Officer of the UK. He's now running this. Mark is on our design committee. It was easy. I said, Mark, you're in, so they're in. And Johnson & Johnson. I want you to say a word about this, okay? But I mentioned earlier that they're going to support $4 million for the Catalyst Award and 5 for the what we consider as Challenge Awards, right? And I'm now working with NIH. Lots of bureaucracy, believe me. But we got to have NIH in. Let me talk about EU. So EU, I've gotten a proposal from them of 25 million euros to do this. And they will bring in a whole number of countries under Horizon 2020, the Innovation Medicine Initiative. They have a whole initiative on healthy aging, active living, or whatever it's called. I still work through it, so it's not done yet. And most of what I'm doing right now is getting through the MOUs and contracts, which, as you know, Liz, actually, AMET said they haven't received it yet. They just sent me a note. Maybe he's been traveling. Okay, so we are now teed up for well in excess of how many, Liz?
About 500.
500?
I'm sorry?
How many awards altogether?
Oh, yeah, it's a few hundred.
Yeah. And so I think we're in good shape now. It's not done yet because I'm doing MOUs and things like that. And until everything is done, it ain't done. But the time it would take for us to do would be to get the design committee back together. That includes Mark Fishman, Ed Holmes, Stein Griffin, many others, that you're part of this, right? And to get this group together to make sure we harmonize all the selection criteria, that we agree on the launch, and then we agree on how to move forward because people have different budgetary cycles, et cetera. So my guess would be I'm going to get the international leaders together by the end or early next year, and then we can get them all done. We'll launch it somewhere around early Q2, end of Q1, 2019. I don't know yet. We'll see how well we go tonight. Right? Okay, so you have to say a word about J&J.
Sure, happy to. So we got involved because a few years back,
Okay, I'm done with these two,
The
then I'm done.
aging population, and the company J&J very broadly based, it makes consumer products, medical devices, and pharmaceuticals. And we realized that the current paradigm of spending billions of dollars and failing continuously to make a drug that you sell for an extraordinary amount of money is not really sustainable. But rather, as we age, and as populations begin to age, and let's say somewhere around 100 might, plus or minus 10, 20 might be max, you begin accumulating, as you saw in one of the slides earlier, you begin accumulating diseases around 40. So if you live to 40 or 50, it wouldn't be such a big deal. But if you live to 100, you're going to be accumulating more and more diseases. And it's going to be extremely costly to society and extremely costly in terms of your health to people in the world. So we flipped it around and said, you know, all of us are incubating diseases. But we just don't know what they are or from where they come. But what if we could understand what diseases we're incubating and then intervene before the disease ever occurs? And that led to this thing, first called the Disease Interception Accelerator, then the World Without Disease. And we've been able to